Hello, this is my SMART goal plan for Mrs. Peterson. This is the learning objective and domains. They're essentially going over the psychomotor domain, and then by the end of this lesson, that will be presented to Ms. Peterson. Our client will be able to demonstrate the use of the essential spirometer to complete a cycle of deep breathing exercise while maintaining oxygenation. And the psychomotor domain is going to be used as like a demonstration as a form of learning. And then this is our content and our plan. For the intro, for the content, the reason why we're doing this is that the purpose of the care plan is to become familiar with breathing exercises and using this as a spirometer and managing oxygenation. For example, in our case, Miss Peterson has pneumonia, and so it'll be beneficial to practice those breathing exercises. And so the time and location, and so for the time of our sessions will take approximately 30 to 40 minutes depending on our exercise tolerance for Miss Peterson. And then the sessions will be conducted in Miss Peterson's hospital room, where the environment of the hospital room demonstrate calm, quiet, appropriate environment to demonstrate those exercises without distractions. And then also in that hospital environment, we'll have access to all the equipment, such as for demonstration for the essential spirometer and access to oxygen equipment in case of respiratory distress. And so for our content and our plan, the equipment, so for the content in our plan, the equipment that we'll be using will be such a spirometer, a pulse ox available, vital sign monitor, and oxygen equipment. And the discussion of our plan is practice using the central spirometer to assess and improve lung function, and also encouraging and providing support for Ms. Peterson throughout the process in order to participate in breathing exercise and the use of the essential spirometer. And also throughout the process, we'll be assessing her vital signs regularly to ensure the oxygen status and respirations remain adequate. And then we also will assist Miss Peterson in her ADLs, and then we'll also document progress of how much easier it is for her, I guess, like before and after, throughout her breathing exercises in the process. And then before we get started with Miss Peterson's teaching, we'll be providing a pre-quiz on what is respiration rate and what are the ideal levels, what is oxygen saturation and what do our ideal levels look like, what is an essential spirometer, and what is the purpose of the essential spirometer. And then we have our teaching methods, which I will shortly be teaching to our patient, Ms. Peterson. And then we have our strategies, our instructional material, and the time frame of the process. And their strategy, the purpose of this psychomotor domain strategy is to focus learning through the hands-on approach to understand the use of the spirometer. Learning through the hands-on ensures that Ms. Peterson can confidently demonstrate the essential spirometer independently. The psychomotor strategy encourages regular use to promote lung expansion and improved oxygenation. And the instructional material that we'll be using will be the incentive spirometer, the printed instructions, and the pulse ox. And our session together will take approximately 30 to 40 minutes. That includes the pre-quiz, the time of how long the instructions, and the demonstration. And hopefully by the end, when she will do it independently, it will take no more than like 10 to 15 minutes by herself. So say hi to her patient. Hi, Miss Peterson. My name is Joe, and I am your nurse for today. And then I just wanted to go over. I know that you have pneumonia, and I probably feel that it may be a little hard to breathe. I assume that there's a lot of fluid buildup in your lungs. Maybe your lungs just feel like you feel like you're not getting enough air. And so the reason for my visit is that I want to be able to maybe we'll do assess your lungs. We'll do some exercises, and I want you to be able to use our equipment such as our essential spirometer, which will be able to use to exercise your lungs regularly, and hopefully breathing won't be as difficult as it is now. The more sessions we do, we'll be able to meet our goal and we'll be able to breathe easier, maybe get through assisted daily living a lot easier. And yeah, we'll be going through how to take care of your lungs by using the exercise that we'll provide for you. And so just I guess a demonstration of what our inception spirometer looks like. Here is our inception spirometer. And let's see that we have like a little tube. That's where that's like the little mouthpiece where that you'll be breathing into. And then inside this little gauge, there's going to be a little ball inside. And then that's when you blow into it, and then we'll be seeing like the ball will be a kind of more targeted range of where you would like need the ball to remain, and that's how you'll be able to exercise your lungs the way you'll be breathing like back and forth. So I guess like a more in-depth instruction of how to breathe. And so first, as we prepare the spirometer, we want to make sure that you are positioned in a proper position to where you're able to fully access your lungs. I guess keep your lungs at a more advantageous point, and so we'll be sitting more upright to ensure that we have the proper lung expansion. And so while we set up the spirometer, before we set our mouthpiece, we want to before we insert the mouthpiece, we want to do a full exhale. We want to empty all the air out of our lungs before we do a deep inhale. And so then once we seal our mouth onto the mouthpiece, we want to inhale slow and deep, and then we want to target that marked area on the device. As we blow air, the ball will rise, and then we're going to hold that breath, and then we're going to exhale slowly, 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 and then we're going to rest our lungs, and then we're going to repeat the process. And then throughout our exercise, we're going to monitor this progress, and then we're going to mark how we're doing, mark our progress, how long we're able to hold that ball in that targeted destination for on the gauge. And then we're going to monitor for any signs, see if you're feeling any dizziness, see if you're feeling shortness of breath, if you're feeling any discomfort. Luckily, because we're in the hospital environment in your patient room, we'll have access to equipment in case you feel like you need a little more air. Then we'll provide oxygen for you, and then we'll also assess your vitals, see how your respiratory rate is, see how your oxygen saturation is. How long the session we'll have with each other, will be around like 30 to 40 minutes long, just because we need to ensure that you feel confident enough. You need to ensure that you're able to use the incentive spirometer independently. But once you have the incentive spirometer down, I think the sessions that you'll be doing will take no longer than like 10 to 15 minutes. Just because the idea is easy, the idea is semi simple. Just breathe into the ball, and then you kind of get a feel of how your lungs are feeling. So after say about like a week of our care plan, Ms. Peterson will be able to use the barometer independently for 10 to 15-minute sessions, and then further along she'll be able to assess, and then her lung function would improve by then. Here are my references, and thank you.